Becca Lane is a policy analyst at the exchange, and she will be running the slides today. And then please also to have colleagues from the MIA on if any their expertise is needed in the conversation. So this is our annual public forum for the state reinsurance program, which we hold annually pursuant to requirements under federal law. And of course, we are also happy to engage the public on the program. So the goal is to give you all an update on how the program is doing, and also give the public an opportunity to comment on the progress of the waiver thus far. Next slide, thank you. So performance for 2021 and 22, our proposed 23 reinsurance parameters updates since our last public forum last summer, including updates on carrier accountability reports, which is a state tracking and a reporting mechanism that we have. And then, of course, happy to get public testimony. So if you would like to testify and you haven't already used our Google form to let us know about that, you can sign up using the form in the comment section. And if we don't have that in the comment section, you can go ahead and just type in that you would like to testify at the end to the chat portion of the Google Meet. And if you are joining by phone and you don't have access to the chat, we will also make sure to pause and give anyone on the phone an opportunity to provide testimony. So definitely want to hear from anyone who has information they want to share. If you're, until we get to the public testimony period, if you could please make sure that you are muted so that we avoid any static. All right, thank you. Okay, so wanted to share what we can say about the most recent information on the program's performance. Next slide. So we continue to have a good story to tell about the significant impact that the reinsurance program is having on the individual market. You can see premiums are still more than 30% below where they were prior to the launch of the program in 2018. We did see premiums start to increase in 2022. That's not unexpected. That really indicates that we've kind of re-baselined. We've realized that full impact of the reinsurance program. It's reduced premiums to a new lower baseline, and now they are starting to increase as premiums normally do with medical trend and other market impacts. So there was an average 2.1% increase in 2022. Proposed rates for 2023 have been filed with the MIA, and there is another proposed increase, but we won't know, of course, what that increase will really be until rates are finalized later this year. So, still seeing a major impact of the reinsurance program on rates. I think the next slide continues to talk about how our premiums compare, looking nationally at our lowest cost premiums at each metal level and comparing those to the national average. Our lowest cost plans are about 20 to 30% below US averages. Our average premium on the exchange is in the lowest among the lowest 5 states in the country. So the reinsurance program has really been extremely successful at helping to reduce premiums. And we see that in our national comparison data. Yeah, next slide. So if we look at the rate impact by carrier of the reinsurance program, you can see on this slide a chart of what the anticipated rate change would have been in the absence of reinsurance versus what it was with reinsurance. And you can see in that 2022 rate change without reinsurance column that we would be seeing some major increases if the reinsurance program were to end. No plan for that to happen, thankfully, but just further evidence of the significance of the program on premiums. And switching from premiums to enrollment, we continue to see significant enrollment growth in the individual market. This has been a trend for several years. We can't attribute this solely to the reinsurance program. There have also been premium reductions due to the enhanced premium subsidies available through the exchange from the American Rescue Plan Act for 2021 and 2022. So that has also helped to drive premium, but that's worked in combination with the reinsurance program to support enrollment. So total 2022 individual market enrollment on and off exchange is up about 10% year over year, and our individual market enrollment is up at an all-time high. We hit about 180,000 as of the end of open enrollment for 2022. So really excited to see that strong growth. Yep, next slide. And you can see, much as we estimate premiums would have been higher without reinsurance, we also estimate that individual market enrollment would have been approximately 8% lower, and I think that's probably conservative without reinsurance. All right, next slide. Wanted to share some information on how the balance sheet for the reinsurance program and what we're looking at for our upcoming year of 2023. We project that using the current program parameters, so that's a program that takes effect between $20,000 and $250,000 in annual claims per enrollee, and the reinsurance program covers 80% of claims for people within that window. So if we maintain those parameters, regardless of whether the American Rescue Plan Act is continued, which will have an impact on our balance sheet, but in either case, the program will remain solvent through the end of 2023. So you can see in this chart, the bottommost row, end of year balance state, shows how much funding we anticipate ending the year with. And in either of the two right-hand columns, whether the American Rescue Plan ends or continues, we anticipate ending with a positive balance of state funds somewhere between about $200 and $300 million. For 2020, well, starting in 2022, our annual federal and state funding is expected to be less than the annual cost of the program. That will be the first year in which that happens. Up until 2022, federal funding has fully funded the cost of the program each year. We haven't needed to draw on our state funding. But in 2022, we're anticipating that we will need to start drawing on state funding to support the program, and that will be necessary in 2023 and future years as well. And that is due to a number of factors with changes in market dynamics. Federal funding has decreased from the high levels that we saw in earlier years of the program. And of course, the cost increases each year with medical costs. So let's see. I think the only other thing I'll say about this slide is just to note that whether the American Rescue Plan Act ends at the end of this year or is extended by Congress does have a meaningful impact on the funding situation for the program. That's because the American Rescue Plan Act increases premium subsidies, and the reinsurance program is funded as a result of a measure of how it reduces total premium costs to the federal government. So the federal government's costs are higher when they're paying higher subsidies. That means we get higher pass-through. If the federal government is paying lower subsidies, we get lower pass-through essentially. So If the American Rescue Plan Act ends this year in 2023, we would anticipate federal funding of about $272 million. If it continues and the feds are still paying those higher subsidies and we get higher pass-through, we'd anticipate about $400 million in pass-through. So we'll be watching eagerly what Congress decides to do, both for the reinsurance impact and also because it is, also meaningfully reducing folks' premiums to have these enhanced subsidies. All right, I think that's all I had to say on that slide. So I'll switch gears to talk about the 2023 reinsurance parameters. Next slide. The board is required to set the payment parameters for the program each year, and that includes determining an attachment point. That's the point at which the reinsurance program starts paying claims or starts reimbursing carriers for claims costs for an individual. The coinsurance rate, which is the percentage of claims that the program reimburses to carriers, and the reinsurance cap, which is where the program ends and carriers again are responsible for the full amount of an individual's claims. And the fourth factor is set by the commissioner if directed to do so by the board. And that fourth factor is what we call a dampening factor. That's meant to account for the interaction between the federal risk adjustment program and the state reinsurance program, both of which are covering claims for high cost individuals. And so this is an effort to kind of correct for the interaction between those programs. So the board sets these parameters each year for the following year. At this point in the year, they have set the estimated 2023 parameters, and they are meeting next week to hopefully set the final 2023 parameters. So if we continue on to the next slide, you can see that the board set estimated parameters pursuant to staff recommendation for 2023 that continue the same parameters that have been in existence since the program was started. So you can see in the chart at the bottom, we've held those parameters, the attachment point, coinsurance rate, and cap steady over the years and are recommending to continue to do so in 2023. The dampening factor, there has been a dampening factor each year, and we recommend that there be one again in 2023. That specific factor has varied somewhat based on actuarial analysis. Continuing on, our next steps, most importantly, next week, as I mentioned, the board will be setting final 2023 reinsurance parameters. So if you're interested in that conversation, you're very welcome to tune into our board meeting. The information to join that should be on our MHPD website. Next. All right, and then we'll talk a bit about program development since our last public forum. Next slide. So as I mentioned, we've set the estimated parameters, or rather the board has, and we'll be setting the final ones. We've also collected data from the carriers over this past spring on their claims experience to help us update our modeling and finalize our recommendation to the board regarding those 2023 parameters. We will be collecting carrier accountability reports again from the carriers later this year. We're a little bit delayed in that through some just full plate at the exchange on various projects this spring, but we'll be getting those from carriers. And as we have done since the program started, we'll be paying carriers in 2022. They'll be getting their reinsurance payments for the prior 2021. Next slide. A big notable event that happened since the last annual forum occurred with the passage of House Bill 413, Senate Bill 395, which extends the fee that provides the state funding for the reinsurance program. That fee is a 1% assessment on insurers, and it had been set sunset at the end of 2023, which is when the end of our first 5-year waiver with the federal government ends. So the fee was in alignment with the duration of the waiver we received by the federal government. Because we anticipate applying to the federal government to extend that waiver, we also need to be able to demonstrate that we have a source of state funding to provide the state portion of funds to support the program. And so because we need that, the legislature and the governor worked together to pass an extension of that 1% fee. So now no longer ends in 2023, but instead ends at the end of 2028, which would be the end of our second 5-year waiver period. Included in that legislation was a requirement that the MIA lead a work group in consultation with the exchange to study the impact of the program, possible funding sources for the program, the appropriateness of the 1% fee, and then broadly market reforms to support affordable individual market coverage. And that report is due December 1st of next year. So we'll be working closely with the MIA when they get that work group going, but still some time between now and December 1st. And then the other thing I wanted to cover was our plans for applying to the federal government to extend the waiver for a second 5-year period from 2024 through the end of 2028. Per federal guidelines and regulations, the state is required to submit a letter of intent indicating our intent to apply for an extension at least 1 year prior to the waiver's end. And then we're required to submit the actual application within the first quarter of the year prior to the waiver's end. So what that means is that in practice, we're going to be working over the next month or two to draft that letter of intent. We'll be taking that to our board in the fall to ask them to authorize us to submit that, and also plan to submit that in the fall prior to the end of the year. We'll be working with the MIA and our consulting actuaries on our waiver application, which we will aim to submit early next year, and hope to get that approved in the first half of the year, with the second 5-year waiver period beginning January 1st. Not shown on this timeline, but intended as a part of our process will be to gather public comment on the waiver extension application. So we do intend to engage the public in that effort, and we'll share more information and ensure that there is opportunity for public comment prior to submitting that to the federal government. And I think that might bring us, oh, no, one last section, carrier accountability reports. So lastly, wanted to share an update on information that we've gathered through the carrier accountability reports. Last year, we shared information from the 2019 plan year. This year, we're sharing information from the 2019 and 2020 plan years. There's always a lag in reporting and then our collection and analysis of the data. So at this point, we've only got 2019 and 2020. Our regulations require carriers to submit an annual report that describes their activities to manage the cost and utilization of enrollees whose claims are reimbursed by the reinsurance program, as well as efforts to contain costs so that their enrollees don't hit the threshold for payment under the reinsurance program. We have reports, as I mentioned, from 2019 and 2020 submitted by CareFirst and Kaiser, which are the two carriers that were in the individual market in those years. And so we'll share with you some high-level information on those reports. Next slide. The reports collect a range of information. I won't read through everything on this slide, but at a high level, we're collecting claims, demographic, enrollment information on enrollees. We're collecting estimates from the carriers on savings to the reinsurance program based on their care management initiatives and descriptions of those care management initiatives. And then we're collecting some HEDIS measures relevant to specific conditions that we are interested in tracking. Next slide. In particularly, we are collecting data on carrier initiatives targeting 4 areas that are for which the state has population health goals, and those are diabetes, behavioral health, asthma, and pregnancy and childbirth. And we also collected information on the impact of COVID-19 for 2020. If we continue on, we can share some high-level information. So this slide shows the number of enrollees and percent of enrollees with claims reimbursed by the reinsurance program. So you can see we had roughly 12,000 individuals each year who had claims reimbursed, and CareFirst accounted for about 80% of those individuals. And similarly, a similar percentage of the total reinsurance payment. We don't show data by age breakdown on this slide, but perhaps unsurprisingly, adults aged 55 to 64 accounted for the largest portion of individuals who qualified for reinsurance payments and individual total dollar figure of reinsurance payments. Next slide. In terms of the carrier's care management initiatives, neither carrier had care management initiatives that met our reporting threshold for asthma or pregnancy. They did, for 2020, they did both have initiatives targeting behavioral health and diabetes. And I won't go into specific details of what those programs are, but you can see a little bit more information on this slide. Next slide. We aggregated information from the carriers on the conditions that were the most frequent and the highest cost for reinsurance claims. And you'll see here that several of the conditions that we identified to collect detailed information on that are state population health priorities do fall into these most frequent and highest cost categories. They're shaded in blue. And so you can see diabetes is among the most frequent and highest cost conditions in both years. Asthma and COPD was among the most frequent in both years and among the highest cost in 2019. And then in both years, the highest cost condition was cancer, and then congestive heart failure and sepsis and respiratory arrest were among the highest cost in both years as well. So I'll just say with that, we are continuing to think about how we can enhance the information that we're collecting through these carrier accountability reports and the best ways that we can use these to engage with the carriers on conversations about their care management initiatives, so that that's an ongoing effort at the exchange, and we're glad to be getting this initial kind of baseline data and to use it to shape our plans going forward. All right, I think that wraps things up, and I'm happy to take public comment at this point. Becca, do you have individuals who have signed up in advance that you'd like to invite to speak?
Sure. We have Allison Taylor from Kaiser. Oh, you're on mute, Allison.
Hey, thanks everyone. Thanks for having me today and the opportunity to provide public comment. Just wanted to start out, we applaud the goals of the reinsurance program to make coverage affordable for people in the individual market, and we applaud the exchange for the efforts you've led in spearheading this and for administering the program really well. So thank you for that. a couple of comments. One, as the legislation moved forward this session, it became clear that the costs in the individual market are projected to continue to rise, whereas, as Johanna mentioned earlier, we're expected to get less federal money. And this situation becomes much more difficult if Congress doesn't extend the ARPA subsidies, as we all hope that they're going to do. I think this is really a great illustration of a larger problem in healthcare, which is that costs generally continue to rise, whereas, and that there's just a need to rein in overall spending. And, as I see it, and I think as Kaiser Permanente sees it, the real problem with the individual market is not that premiums are too high. It's that, the people in that market are just really, really sick. And that's what's driving up costs. And so there's probably opportunities to really manage the costs of individuals whose claims are reimbursable by this program. They're the sickest, probably sickest in the state. And so there's probably a great opportunity for carriers to help manage those costs and, use that as a mechanism to help reduce spending. And so to that effort, we do appreciate the portion of the presentation you just gave on the carrier accountability reports. And, I saw in your recently released strategic plan that you're looking at hiring a consultant to dig even more into that, which I think is great. Kaiser Permanente puts managed care at the center of our model generally, and we look forward to working with you all to help keep these members healthy and control costs and generally be good stewards of the state's money that goes towards this program. So that's it. Thanks for the opportunity to speak.
Thank you, Allison.
I think that's all we had for public comment, at least on the form that I'm looking at. But if anyone else has public comment, even if you didn't sign up, now would be the time.
And if you're on the phone and need to unmute, you may need to press *6 in addition to unmuting by pressing the unmute button on your phone. We'll sit tight for another minute or so just to make sure that people have a chance to unmute themselves if they want to. And if we don't hear any other comments, we'll conclude. All right, I think we'll go ahead and wrap up. Thank you, everybody, for joining us today. We're really pleased to get to implement this program on behalf of the state and to work with all of our great stakeholders on it. And if you have any questions, please feel free to reach out to me and Becca. We didn't put our contact info on the slides, but hopefully most of you have it. If not, you can always find information on our board meetings and join those on our website. That's another great way to get involved. All right. Thank you, everybody. Take care.